So a shoulder dislocation happens. Now the exam asks, is the labrum torn or the humeral head is dented? Now this is the classic difference between Bankart's and Hill-Sachs, which is a common trap in INICT, FMGE and NEET PG. So let's discuss about it. So in anterior shoulder dislocation, the humeral head comes forward. Now around the glenoid, there is something called the glenoid labrum. As you can see here, it's basically like a soft tissue covering which deepens the glenoid. Now when the humeral head comes forward, what happens is there is injury to the anterior inferior glenoid labrum, okay, because of the shoulder dislocation, anterior shoulder dislocation. And then because of it, there is a torn in the anterior inferior glenoid labrum. Now this is what is the Bankart lesion, okay. And the effect of this is it causes recurrent anterior shoulder dislocation and it causes instability of the shoulder joint. Now there are two kinds of Bankart lesion you must have heard. One is the normal Bankart lesion, other one is the bony Bankart. So in bony Bankarts, along with the soft tissue, there is also chip off of the glenoid labrum, the bony part. So as you can see here, so that is called as the bony Bankart. Now coming quickly to the Hill-Sachs lesion, it is basically a compression fracture of the posterolateral humeral head. So somewhere here, as you can see, there is a dent. That is the Hill-Sachs lesion. And this is also caused because of the impact of the humeral head against the glenoid during the anterior dislocation. And this is also associated with recurrent dislocation and shoulder instability. So again, the key difference between Bankart's and Hill-Sachs, Bankart is damage to the glenoid labrum, okay, this one, the glenoid labrum. And Hill-Sachs is basically damage to the humeral head. You can just remember it like a dent. And in NEET PG, usually what will be given to you is an image and they will ask what lesion is this. So they'll either point at Hill-Sachs or Bankart's. Now both of them, the repair is done either arthroscopically or mini open surgery, which usually won't be asked in NEET PG, but you can read about it, very interesting surgeries. So this is what is Bankart and Hill-Sachs, a commonly asked question in NEET PG, INICT and FMG. Thank you.